So then sometimes people ask about bowel training at night. So most people don't have bowel movements at night, don't poop at night, but some do. I mean, when they're sleeping. So this can be a complicated and more sort of individual issue than nighttime urine training. It's not common for people to have bowel movements while they're actually sleeping. Um, it's one where I'd very much suggest talking to the doctor about it too. If you have a trainee who does seem to be pooping when they're sleeping, there could be some muscle issues that need to be looked at, or the consistency of their poop is so liquidy that they're kind of having a constant leak even at night. That's something that you just have to get sort of medical clearance and guidance on before you work on it. Yeah, things like a known sleep disorder, chronic constipation or diarrhea, they could be intervening factors in this issue too. Um, this is one we really are cautious about ever saying that anything around toileting is a problem behavior issue. Pat has said a million times, in many contexts, toilet training is about good instruction, good teaching. The likelihood that it's the learner emitting any sort of problem behavior is very low with pee and poop stuff. This one, I do encounter families where, yes, poop at night is a problem behavior issue a bit. So I'm very cautious in saying that to you. But if you have a trainee who's in their bed at night, smearing their bowel movement, smearing their feces around, a lot of, touching it, or like doing a bowel movement on the floor and then calling for parents, it can be another issue. So you might need to talk to a behavior consultant, the BCBA, who could help you with a functional assessment of that, because it could be about getting you in the room at night. There's an attention function. It can be a complicated one. So yeah, there's a lot of considerations here, and a lot of the things that we'll talk about later today, we're going to give you some special problems, some case studies, are these situations that are, yes, but like we've given you all these good procedures to follow for all sorts of toileting issues, but many trainees come along who need a little extra help. Like I wouldn't have a job if they didn't. So it is common. There are people who are outside the boxes of sort of typical reactions to toilet training. So sometimes a nighttime bowel issue is that, for what it's worth. Yeah, the approach, once you've kind of figured, okay, this person is just someone who's going to have bowel movements at night. That's when their body is producing them. You can go forward from there. You would use a very similar procedure to taking the sort of baseline information of when they're likely to poop that Pat talked about in the long way. You would need to figure out when they're likely to poop at night and then awake them for a bathroom trip around or just before that time. So you need some data. You need to, for a little while, be doing, again, you're going to lose sleep. You need to do some checks at night. So you might do, if the trainee normally goes to bed at 9 p.m., say you go to bed at 11. At 11, you might creep into the room, check if there's a bowel movement. If there's not, mark that down. You need to check again, probably about 1 a.m., again, probably about 3 a.m., and just be sure that you know when it's likely to happen. And because the alarm won't work for a bowel movement, they really only work for urine, right? They're liquid detecting alarms. So you need to be the alarm for bowel movement training at night. So you would need to figure out when it's likely to happen and help them do a bathroom trip to the bathroom in the middle of the night. Yeah, and same deal. You'd want to give a big reinforcement in the morning if no bowel movement overnight. By the way, I should say too, if this is something, so a bowel movement, a poop happening at night while the person's in bed and they're supposed to be sleeping or are, if it's something that happens really seldom, you probably don't have a problem. It's just something that happened, a phenomenon once in a while, right? If it's something that happens once every few months, you don't need to do this procedure most likely. It's just something that happened. It's like when, you have a little toddler and they poop in the bath. They're just going to do it once in a while, right? It's a normal part of life. You can't predict when it's going to happen. But if they do it once every few months, you probably don't need to make a bunch of arrangements around it and try to prevent it. It's just something that happens. So don't worry about this unless it's a pervasive issue, because what we're asking you to do here is a lot, right? It's, you have to take baseline where you're waking up frequently, and then you have to do the treatment where you're waking up frequently. It's a drag. So don't do it unless you have a real problem.